Good evening, Irene. How are you?
Good. Before we move on for your presentation, as I was reading your bio, it's very long, and it came as a surprise to me that you actually passed your medical exams in 1998, which, if my math served me right, it's 22 years.
Yes,
right?
Probably about 22 years ago, correct.
Yes. So how do you accumulate such a long title, and how do you still look so young? That is my pertinent question.
I think a lot of us, we accumulate titles, I would say by accident or by the work that we do. So for most of us, we have our, shall I say, clinical engagement. We see patients, and with that, we gain our experience. I guess along the way, we also pass certain exams and choose to specialize in certain areas of medicine.
You mean to say that after you pass your medical exam in 1998, you have to continue to take exams?
Yes, I think I took exams almost every other year or every year. So them.
Says, how often after 50 do we have to do colorectal? Annually? Every 2 years? How often?
So that's a good one. So I think if, let's say, the first scope is normal, the guidelines range from, depending on age of patients, 3 to 5 to 10 years, depending on which data. So it's a little bit flexible, or there's a wide range, because it already really depends on the patient's clinical history. If, let's say, there's a very strong family history and there's a lot of polyps, each time we check on the scope, that probably needs to be done yearly or very regularly. If, let's say, there's no family history, patients of a certain age, then sometimes we space it out every 5 to 10 years.
Okay. Someone said that they heard from friends that pancreatic cancer is a silent killer. So when should an individual go for screening, and what kind of screening in particular that can cover this gastrointestinal risk?
Yeah, so pancreatic cancer is something very close to my heart, because I treat a lot of patients with pancreas cancer. The most common symptom that patients will typically describe when they have it is usually loss of appetite, loss of weight, unexplained. That means it's not because they're dieting, they're losing weight, and they've lost.
No, I definitely don't have that problem. Even if I try to diet, the weight just keeps growing.
And the worrying one is back pain. So unexplained back pain. That means they can't, to the extent they have difficulty sleeping at night. So it really is bothersome. So that usually is pancreas problem. So those need to be checked out.
Okay. Any link of having piles to colon cancer? Is it correlated?
No, it's not correlated. So the worrying thing about piles and colon cancer is sometimes, piles is such a common problem, and we may be having this even as normal people on and off. Hopefully, as long as we have good habits, taking enough vegetables, good diets, usually these things don't persist. The problem is, if, let's say, patients have persistent piles, they already see the bleeding regularly, then they sort of dismiss and attribute the bleeding to the piles, not knowing that there may be a problem with the cancer higher up. So it's sort of the problem being masked by the ongoing symptoms, because the piles is not treated.
I'm diagnosed with colon cancer stage 1 10 years ago at age 35. Should I encourage my children to go for scope early? If yes, when would be the good time to get them to do scan?
Okay, this is a tricky one. Yeah. So the rule of thumb is that because you are the index case, that means first case in the family, age 35. So there's doctors we say minus 10 years for all your offsprings. So in theory, it's supposed to be age 25.
How about polyps? Someone said that not all polyps will develop cancer, but it is still advisable to remove all polyps. Is it still advisable?
Okay, so this is a very technical question. Doctors spend a lot of time arguing and talking about this. So there are
you know that you guys also argue.
So polyps, I would say that not all polyps are cancerous. There are some of them that are that potentially can change into cancer. So those that don't, should I say, have the potential to change, usually can be left alone unless it's causing problems like bleeding, forming ulcers in there. So yes, not all polyps need to remove. That's true.
Anyway, we thank Dr. Lee for his precious time. And I think, like yourself, if I have so many questions to ask and I'm not being answered, what I'll do is I'll make an appointment to see Dr. Lee or with the clinic, all right? So thank you so much, Dr. Lee, for your time. Any one last takeaway for all of us here?
I think the key part is get yourself checked. I can't emphasize this too much because I guess from a doctor's standpoint, if I could just have 30 seconds, right? Age 30, 40, 50, 60. So age 30 is usually around the time we are sort of starting to get married, getting serious about relationships, starting to have kids. Yeah. So get a check then just to make sure that you yourself, your partner is all okay. Age 40, your career is rolling along already. You don't want to get in trouble for running a marathon and something happens. So I say this because one of my good colleagues just passed on suddenly after a run just 3 days ago.
Yes, I saw the news. I sent you my condolences. Very
sad story.
Yeah.
It's such a nice guy. So this is completely unexpected. So I myself have done a full comprehensive check. I mean, scanned my brain all the way to the toes, literally. So that's the extreme. So age 40, I did that for myself. Age 50, that's what the government already mandates. Go for your scope already. And always, they keep selling the message that check for diabetes, high blood, cholesterol. I'm sure that is all well done. Age 60, usually some problem already, hopefully something small and solvable. So it's always good to check it early because oftentimes there are not much symptoms for a lot of these things. By the time there are symptoms, we think that it may be a little bit late.